October 2006, a number of individuals from two groups, PIPS and RAISE, embarked on a development programme with the PPR project. PIPS and RAISE provide support for those affected by suicide and self-harm in North Belfast. Both were set up as responses to a critical rise in suicide and self-harm in local communities. Members of the group had already been involved in the successful campaign to get a suicide prevention strategy for Northern Ireland, Protect Life. They were also fully aware that getting the policy was only the start of a long, slow process of making change happen. Their main aim was to find out how human rights could be used in their struggle to improve the mental health services that were available to them. This is the story so far of the PIPS RAISE Rights Group.
We hope today will be useful and relevant to the groups who have struggled to make these issues visible, and will enable them to move forward not on the basis of their need but on the basis of their right. And that's the purpose that we are all here, it's the purpose the panel is here, and it's the purpose of this project.
And so it's very exciting to be here and to see how international law is being put into practice on the ground by real people.
We wanted to know as much as possible and about how things could change for the better, and knowing about rights and how to use them seemed an important way of doing this.
Right now a lot of attention has been paid to mental health issues. A lot of policies are being put in place. Policies are fine, but unless they're transferable they really mean nothing. And a number of government committees have been set up which many of us find confusing. What we have found different about the approach of using human rights is that we as people on the ground who are most affected by the issues are setting the agenda about what this change is, how it will look and when it should change.
We would like to be involved in the change.
In North Belfast, suicide rates are around twice that of Northern Ireland. It is also where the highest rate of male suicide is found.
It started around about September. John started getting very paranoid and thinking people were out to get him and all this here. It was the 17th of October that he had just disappeared out of the house without us knowing. It was 1 o'clock the next day that we actually found him, covered in blood. The psychiatrist then came and spoke to him on the Thursday. And she says, yes, John's quite normal, John could go home. Right, the GP says to me when John was discharged from the Mater there was to be no follow-up, yet they told me there would be. And on the 5th of November, me and my husband went into the town to do Christmas shopping. And everybody was out searching for us. John jumped off the roof of the house. And when we got till the Royal, the sergeant came and says that John wasn't going to pull through, basically, that there was no eye movement, no nothing.
There are very high levels of deprivation in North Belfast. Out of the 10 most economically deprived wards in Northern Ireland, 2, New Lodge and Ardoyne, are in North Belfast. A further 3, Falls, Shankill and White Rock, are in West Belfast.
People should, it's just like a voting thing, you should have a say in everything, you know, what's going on and what's to do with yourself and your family, and you should have a say in what's going on. Try and make things better for everybody.
No, it doesn't have to go on camera, like I just haven't complained.
Why not?
Don't know who to complain to.
If you ask me anything, I think nobody wants to know. There's times people don't care. You try, as you say, what's the sense of putting a complaint in? You know, just, there's times nobody just don't want to know. You just have to keep going until someone gives.
They always say that they put a complaint in so they can learn lessons from it. They haven't learnt much lessons as far as I'm concerned.
Over the last number of years, Government has responded to increasing community concern regarding mental health services through policies such as promoting mental health and Protect Life. In addition, a number of committees, including the Assembly Health Committee, the Suicide Strategy Implementation Body, the Bamford Review and the McCartan Project Board are also working on these issues.
Further, despite a bid for mental health monies totalling over 84 million, the draft budget has allocated a total of only 29 million over the next 3 years, which is a rise in current funding of less than 1%. In stark comparison, from 2000 to 2006, the British government have invested an average 6.6% per annum rise in mental health spending, with 11.8% of the NHS budget allocated to mental health. In Northern Ireland, despite the higher prevalence of mental health issues, only 8.4% of the budget is allocated to mental health. While it is clear that there is a level of commitment to improving services, policy and legislation for those with mental health issues in Northern Ireland, mental health policies are lacking in effective monitoring systems, and many are missing vital opportunities for participation within communities, and the implementation of many policies fall at the resourcing hurdle.
Despite a wave of publicity announcing extra cash for the final health budget, in real terms the rise is equal to 0.1%. The extra monies allocated to mental health still falls far short of what is required. The continuing problems with mental health services have compelled communities to make their own responses.
And one of the things we done and identified in the beginning of PIPS, when you actually lose someone to suicide, there's nobody raps your door. You have a lot of friends and family at that time, but a few weeks after that, you know, people start going away. So one of the things that we felt there was gaps in, certainly within our community, was to actually go out to people who had lost someone to suicide.
My name's Roberta Coates and I am the coordinator of Res Crisis Centre on the Woodvale Road. The centre was established in October of last year in response to the increasing need for support services to people bereaved by suicide, people in crisis, and to raise awareness in the issue of suicide and self-harm, and to reduce the stigma and isolation that accompanies bereaved families, people with mental health problems, and those who self-harm.
During the course of the PPR development programme, the group made a long list of all the issues they had faced with mental health and other services. They then narrowed this list down to 4 issues by identifying which issues were best covered by international human rights law.